I feel that the transition of a patient between providers is kind of like a relay race, and it's won or lost in the transfer of the baton. And it's that baton that is that critical patient information that needs to be safely and efficiently transmitted from one provider of care to the next.
Well, transitions of care obviously was one of the most difficult measures for us to meet, and part of that was because it was so technically oriented and lots of infrastructure had to be put into place. And it was all new for all of us.
There were several vendors in the Arizona marketplace, and none of them had done this before. So that certainly presented some challenges for us.
It was crazy. Obviously, since it was so new to everyone, the vendors all were scrambling.
The first part of what we had to do is we really had to make sure we understood what the transitions of care requirement was and how those requirements affected the direction we needed to go in.
We had weekly team meetings that involved a large group of people. It was a village of people that were required to really learn about this and understand what it was going to take to implement. So I think one of our keys to success was starting off, we set the expectation with everyone that this is going to be difficult, it's going to be a challenge, and let's all work on this together, let's learn together, and figure it out as we go.
We took a pretty practical approach. We said, okay, who are our community partners who we discharge the most patients to? And then we approached those providers and started the conversations with them. So we started down that path and we were able to quickly achieve the 10% electronic transition measure. But through that process, we decided that the rest of the measure, which was 50% of transitions with a paper record, we decided that we would try to attack that measure electronically as well. We looked at PCP groups, we looked at skilled nursing facilities, any provider groups downstream of the hospital. We also talked to them about the benefits of setting up this infrastructure.
The electronic medical record was not meant to be paper, and it does not print in a very user-friendly format. Important information is buried among pages and pages and pages of less important or unimportant data. They didn't want to receive all of that information in that format on their fax machines in their offices. Very dissatisfying for them. Very difficult and time-consuming for them to search through that information for the important things that they needed to know to take good care of that patient. The Transitions of Care project created a CCDA, or an electronic form of the medical record, that could be transmitted in an email type format to the next provider of care. This is valuable information in a format that is going to be easy for them to receive, accept, and continue the plan of care for the patient.
Once this infrastructure was in place, we could really build upon it in future years. And most of the providers that we talked to were really receptive to that. We were fortunate that our community partners were willing to work with us.
Well, one of the things that we did, I think, was very helpful. We had a steering committee that was focused just on this, which really helped our leadership understand the challenges that we were facing. And when we would come to a crossroads and need a decision, they were in the loop, they were educated, and they were able to help us make decisions. So that was really critical to our success.
The communication and the coordination that needs to take place in order to create that safety net for patients is critical for patient safety.
It's not going to be perfect on day one. We had to get over that idea that we're going to achieve perfection. This is the building block. We're meeting the measure. It's not perfection, and it's not going to be perfection until we get down the road as we go through the phases with stage 3 and beyond.